Second thing, I would say the continuity of care in internal medicine, where you get to meet the patient and develop a rapport and a patient-physician relationship, which is the fundamental of the medical science. And another thing that solidified my desire for internal medicine is a story that happened to me during after an internal medicine round where we talked about heart failure. I was going on a rural trip, and there I met a man who needed help. And by taking history, I was able to, and doing examination, I was able to know that he has heart failure with reduced ejection fraction, and listening then to the science. And then I was able to take him to the nearest hospital and save his life. So these are the reasons why I love internal medicine.
Yeah, yeah, that's for sure. Well, I would like to inquire, why you applying to our program? You have
Um,
this.
Yeah, I've taken a time to navigate through programs and apply to programs that fits me the most. This program, I would say, I have worked with plenty of attending who either graduated from the program or are affiliated with this program. And even I also have residents who are doing their residency at the timing at your program, and they all spoke highly about the program, and they were really people that you want to follow their footsteps. They have their practice, and the patients love them. So I always wanted to follow their footsteps. So this is the first reason. Another reason is also the mentorship provided by this program. I was able to see that this program have 100% board passing rate, which really reflects the mentorship and the clinical experience that you get exposed to in this program. And the third reason is that I have stayed in this city for a period of time. I have met friends and people from my community. So I believe this city is like a home to me. So these are some of the reasons.
Yeah, yeah, definitely, definitely, Dr. Mohammed. Well, you have mentioned that you practicing for some time back in your country, and you did, of course, you did some rotation here in the States. So, what you believe the main differences between the Sudanese health system and the United States health system?
I would say the first difference is the role of EMR here in the US, which compiles the patient information and connects the hospitals together. While in Sudan, we rely more on a paper-based system. So that's why we usually spend more of a bedside test with the patient. So if we have a patient, we always have to do history and examination, always. So another difference, I would say, the insurance here in the US, most of the people are insured, while in Sudan, it's more of a pocket money treatment. And that actually leads to people presenting late or seeking treatment on late stage. So I guess in Sudan, we see late presentations more than in the US. The third reason, I would say, the role of primary healthcare and how it helps the community and the surveillance and prevention of diseases. While in Sudan, people usually only seek treatment when they get ill and they go to the specified specialty. So these are some of the differences between here and Sudan.
Yeah, yeah, definitely. Thank you for telling me about this. I don't have any idea before. You have mentioned that you are doing a research fellow at the Michigan State University. Can you tell
Yeah.
me about interesting research project you have been?
Yeah, so recently, a month ago, I published my research about it's called the role of public access automated external defibrillator in out of hospital cardiac arrest. So this was a topic that always goes around on my mind because I've seen that it's the public access AEDs are implemented only in few places, although I felt like it has a vital role. That's why I picked this topic. So I compiled 10 research fellows with me, or 9 research fellows. And then we divided the roles between us. And since I was the leader, I had to make sure that they're motivated and they're submitting their tasks on the specified time. Until we published it, and actually the results showed that the public access AEDs decreased the mortality and morbidity of cardiac arrest. And I'm glad because it shed light on an important topic so people can follow up with more research and expand more on this topic.
Well, that's surprising. I mean, AD, I mean, increasing the mortality and mortality, you find that this through this research.
Yeah.
I was thinking about the opposite all my time. So, uh, well, you know, doctor, we have a lot of the applicants here in our program. What do you believe that make you stand here, and what you think that your main strength?
Yeah, I believe that there are many qualified applicants, but I'm a very good fit to this program because, first of all, I'm bringing a diverse clinical experience. In Sudan, we encounter patients from different backgrounds, different languages, and we deal uh, with barriers like communication barriers on everyday life. And this have gave me an experience because we have to look for alternative way always. So I'm bringing all this experience and I'm also ready to learn at the same time. The second thing I would say because of my resiliency. So since I graduated, my country have been going through unstable conditions, which evolved into a war recently. And throughout all these years, I was able to give back to the community and work, and on the same time also focus on my US journey since it's my dream. And the third reason I would say adaptability. Since I came to the US, I was able to engage with the patients in conversation. They were very receptive and they always wanted to know more about myself. Even when I socialized outside, people were very willing to know me. And I started to learn about, for example, Spanish because people speak Spanish. And yeah, so I'm a very
Yeah, yeah,
adaptable
for
person.
sure. I mean, this is the quality you are looking for. I mean, like, but you know, Dr. Mohammed, that nobody is perfect. So what you notice that you are something you're struggling about. I mean, or what are your main weaknesses?
Yeah, of course. So I believe like self-awareness and self-reflections help the person to grow as in his professional and personal growth as well. So one of my weaknesses is that a weakness that I realize is that I used to overemphasize with my patients. So the story was my first postgraduate experience on the emergency department. And unfortunately, on that day, we lost the patient. So when I saw the parents' reaction, it really, I was emphasizing a lot with that. So the next day I spoke with my attending about the incidents. He told me that it's good to emphasize, but you have to balance between empathy and your professional role as a doctor. So since that time, I started to use this empathy to understand the patient and the pain they're going through so as to provide the best care, but without experiencing the distressing part that compromises my performance. And from that instance, I was able to counsel the patient, to console them, to break down bad news with empathy and compassion. And I've learned from that incident is that our emotions are really great, but we have to direct it in a positive way to get better care for the patients.
Yeah, yeah, for sure. Well, you have been mentioning that you are in the state for a while, but I would like to know, like, what you believe that the challenging you will face it if you choose you to doing a residency here in our program.
Yeah, so I would say a challenge for most of the immigrants for us because we're coming from a different background is the transition as a whole. The transition from, for example, me transiting from Sudan to the US, this is a challenge because you're going to be adapting to a new environment. But fortunately, I was able to come before residency and I was able to overcome this barrier. For example, I've already worked in a clinic. I have met patients, engaged in conversations with them. And outside the clinic, I have been socializing with people. I meet US citizens on everyday life. I'm trying to become part of the community because I believe if you want to treat certain people, you have to be one of them. And luckily, that sort of challenge or that sort of fear from the challenge is now a feeling of excitement. And I'm really looking forward to the residency, right?
Yes, yeah. Well, this is the end. If you want me to ask you some challenging question, I can ask you some challenging question. If you don't,
Okay, we can do one challenging question.
yes, okay. What can you tell me a situation when you have struggling with the professionalism?
So a story that I remember like I said, being from a diverse background, we meet patients with different languages and different social backgrounds. So one day I was taking care of a patient who doesn't understand my language, and I know that one of the primary goals, or one of the our primary goals as a physician, is to respect the patient autonomy. So at that time, because I was providing care for the patient, I really needed to see what's his preference. So I really had a communication barrier with that patient, but fortunately, I did my best, and I reached out to one of his relatives who was far away, and he formed some like he was the medium between us, so he was able to communicate for me the patient preference, and we were, yeah, the situation was resolved.
Yeah. This is happening definitely. So finally, do you have some question for us? I mean, like you can
Uh,
ask them 3 questions, like they are.
I still didn't prepare my questions, so you can
No,
skip.
it's fine, brother. Overall, it was fine. You did great. You're more than prepared, brother. Everything is fine. I mean, like, I have some. I mean, like, we did the regular one. I mean, like, they may challenge you about some questions. You know, like, I didn't ask you about conflict, criticisms, failures, those things. I don't know about the program if they're asking a question like this, but there's some question you need to prepare. Like, they may ask you like. Tell me a situation when you failed or you have a failure. I don't know, but overall you are fine. Like you have just two things, two questions. I believe you struggled with the last one when I ask you, when I challenge you about this. I understand your idea, but you can frame it very well. Even me, I will give this example. You can say that we are an underserviced area, an underdeveloped country, and everything, and we don't have immediately translation for. And our country have a different language, so I needed to rely to the relative to take the information from the patient, like the history and the past medical background. So unfortunately, this thing, I mean, like you can speak about this, like this was unprofessional because I need to have a translator and not rely to the relative. But you need to frame it very well, like you are just I didn't. He will not understand you very well. I believe you can frame it very well. The other things regarding the weaknesses. I don't know. You speak about self-awareness and self-insight, right?
It was an introductory part to the weakness. It wasn't my actual weakness. The
Yeah,
weakness
yeah.
is
We, I tell you what I understand from your answer. I understand that you have your main weaknesses is lack of self-awareness or something like that, and you are treating some patient, and one of the attending give you a feedback like you need to do an. I didn't understand it very well. I don't know. I mean, if me or other else, but I don't know what you are saying. I mean, like what I understand. I mean, in conclusion, that you have a lack of self-awareness and self-insight. That's what I understand it.
uh,
I don't know what you want to say for me. I mean, like,
I think I just mixed it up. I need to make it look better, but that's not the
yeah,
weak.
yeah,
Yeah, the weakness was I overemphasize with my patients, but I need to rephrase it. A lot of people are telling me the same feedback, so I need to.
yeah. That's so not me. I mean, like that's what I
Yeah,
understand it.
I'm
Like,
going to
I
rephrase it.
just tell you that because they may like me. They will not. I believe you need to frame it. Otherwise, it was fine. I mean, your answer is very well. I mean, I have seen you multiple times, and even me, I was preparing a lot of the time. So you are fine. If they will ask you this question, you will be fine. Like I didn't have any other feedback other than this too. I mean, like, but if they want to ask some challenging question, you need to prepare them. You know, like what's your animal, stuff like this. These are the crazy. Like if you tell me an animal, if you relate it to something in nature, conflict, criticisms also. People have been saying like they have been asking a lot about when were the time you received the negative feedback and how you use it probably. Like you need to find a safe answer. Like I don't know, I mean, like, what's the safe answer here? But
I need to prepare.
some people say you need to save answer. I can't hear you. You're muted.
Yeah, I say I need to prepare for this challenging question. I'm going to work on it.
But if your program, I mean, like over me, I mean, I asked at least 3 people who are interviewed the program I will be interviewed at. most of them, they tell me it's conversational. Tell me about yourself. They just want to know you. Like, they don't ask behavioral question. But you don't know. I mean, like, you need to prepare a couple of scenarios.
Of course, we need to be ready for everything.
Yeah. You are doing fine. Keep practicing, and hopefully you will get match if you like this program. The
Thank you.
other things, like, you need to, there's no shame about it. Like, if you have someone inside the program, just mention their names. I mean, like, it's very positive point. I mean, people have been just shy. Say their name. I mean, like, I have this guy, he's in, this is what I will do. I mean, actually, I mean, like, I know this guy, he's doing residency, he's in third year in the residency training. He advised me to come here. He speak very well. This is a very positive point, because what they will be interrupted, like, they will interrupted like, yeah, this guys understand the program, understand the culture, and he or she have someone inside, he will help him with transition, you know, like, it's a positive point. I mean, like, don't be ashamed from mentioning their names. And
Yeah, you reminded me. I need to get their full names so that I can mention them on the real interview.
yeah, that's for sure. That's for sure.
Thank you very
Otherwise,
much. Yeah.
otherwise it's fine. If anyone have feedback for Dr. Muhammad, I want to share it with him to improve his practicing, and it will be fine.
Yeah. Thank you a lot, Dr. Mohammed. I hope you also match on your top program. Anybody else has feedback to me? Okay. Does anybody else want to be interviewed? Um, I think Dr. Mohammed, I think we're done. Thank you very much for your time. All right.
Thank you. Best of luck, brother.
To you too. Thank you.